Incidence and outcomes of poor healing and poor squamous regeneration after radiofrequency ablation therapy for early Barrett's neoplasia. Introduction. Radiofrequency ablation, RFA, is the established ablation modality for treatment of flat Barrett's esophagus, BE. Typically, 2 to 3 RFA sessions are required to achieve complete eradication of BE, CEBE. Multiple large, high-quality, multicenter studies have shown that RFA, with or without endoscopic resection, is safe and efficient, reporting CEBE in 77% to 93%. In a subgroup of patients, however, RFA is unable to convert Barrett's epithelium into squamous epithelium. Some patients experience delayed healing, with mucosal swelling, exudates, and/or ulcerations observed at the first post-RFA endoscopy, poor healing, while others also experience regeneration with Barrett's mucosa instead of squamous epithelium, poor squamous regeneration. Logically, these patients have a higher risk of treatment failure after RFA. Few data are currently available on poor healing and poor squamous regeneration, and current guidelines lack recommendations. Evidence-based recommendations on how to manage poor healing and poor squamous regeneration may improve patient outcomes. The authors aimed to assess the incidence of poor healing and poor squamous regeneration, as well as the relative risk, RR, for treatment failure after poor healing or poor squamous regeneration in a nationwide cohort of all patients with BE who underwent RFA treatment in the Netherlands between 2008 and 2018. Background. Endoscopic eradication therapy with RFA is effective in most patients with BE. However, some patients experience poor healing and/or poor squamous regeneration. Then Munster et al. Evaluated incidence and treatment outcomes of poor healing and poor squamous regeneration. Methods. The authors included all patients treated with RFA for early BE neoplasia from a nationwide Dutch registry based on a joint treatment protocol. Poor healing, active inflammatory changes, or visible ulcerations at least 3 months post-RFA, poor squamous regeneration, less than 50% squamous regeneration, and treatment success, complete eradication of BE, CEBE, were evaluated. Results: 1,386 patients, median BE, C2M5, underwent RFA with baseline low-grade dysplasia, 27%, high-grade dysplasia, 30%, or early cancer, 43%. In 134 patients with poor healing, 10%, additional time and acid suppression resulted in complete esophageal healing, and 50% had normal squamous regeneration with 97% CEBE. Overall, 74 patients had poor squamous regeneration, 5%. Compared with patients with normal regeneration, patients with poor squamous regeneration had a higher risk for treatment failure, 64% versus 2%, relative risk RR 27, and progression to advanced disease, 15% versus less than 1%, RR 30. Higher body mass index, longer BE segment, reflux esophagitis, and less than 50% squamous regeneration after baseline endoscopic resection were independently associated with poor squamous regeneration in multivariable logistic regression. Conclusions. In half of the patients with poor healing, additional time and acid suppression led to normal squamous regeneration and excellent treatment outcomes. In patients with poor squamous regeneration, however, the risk for treatment failure and progression to advanced disease was significantly increased.